Hope it holds off come Tuesday. Thanks, Dakota. Well, EMS agencies will stay busy during this 4th of July weekend, and our reporter Kara Jeffers sheds a light on one solution for the struggling industry in this week's Bill Break.
Welcome to Harrisburg. I'm Kara Jeffers here with Representative Marty Causer, and we are going to do a bill breakdown. You have something for an office of the EMS, is that correct?
That's correct. Emergency medical services in our state is in a state of crisis, and in rural areas it's beyond crisis. So I've proposed House Bill 1491, which would create an independent office of EMS commissioner to really elevate the voices of emergency medical services here in our state to really tackle this issue.
What is the issue that EMS is facing when they don't have that officer, don't have that advocate at the state level?
Well, they're really struggling to keep the doors open to provide service in our communities. We've seen over 50 agencies close just in our state in the last year, and really they need stronger voices at the state capitol. There are many legislators that certainly support them. We've taken many steps to help them, but we have to do more, and we must do more. Here at our state, we have a state fire commissioner, we have a state police commissioner, and the Bureau of EMS is buried 5 layers deep in bureaucracy in the Department of Health. We need a state EMS commissioner to sit at the table with the governor so that we actually have a voice at the executive branch level.
Have you heard of any opposition from this, or can you think of any concerns that people might raise with this?
I've heard really strong support from the EMS community. The Ambulance Association of Pennsylvania worked with me to draft the bill and provided some really great feedback. I haven't heard any negative opinions yet, but it's early to tell.
Yeah, and then lastly, taxpayer money. Is there any cost to this? Is there any benefit the taxpayers will get back from a fiscal level?
Well, that really remains to be seen. We have an office currently, like I said, within the Department of Health. This is basically elevating the stature of the office so that they have a seat at the table at the cabinet level. So I don't see a big fiscal impact. It's using revenue that we're using right now to support EMS, but as I said, it's really elevating the voices and bringing a seat at the table at the executive level so that we can do more to help these EMS agencies provide these life-saving services in our communities.
Yeah. Thank you so much for your time. This is legislation that doesn't always get the spotlight, and that is a wrap on our Bill Break.